Cloud. Okay. Okay, hello everyone, this is Jeanette from IASP. I would like to welcome you to today's webinar on person-centered integrative global approach to chronic low back pain. This is the latest in the series related to the 2021 global year about back pain. We're very excited to have you join us today, and we're looking forward to our presentations this morning. Just before we start today, you can interact with us during this webinar. To ask a question, please type your questions into the Q&A box in the Zoom meeting control panel window. If you have a general question about the length of the webinar, if a recording will be available or something like that, please use the chat box. You can also use the chat box to tell us where you're tuning in from today. It's always very interesting to see where we are in the world and who's joining our webinar. After this webinar, the recording will be available on IASP's website, and anyone that's registered for this event will receive an email letting them know the recording is available. You can tweet using hashtag #GlobalYear2021, and you can follow IASP Pain on Twitter. And then you can also visit iasppain.org/globalyear for resources and look at our brand new redesigned website. I invite you all to visit our online website today after this webinar. Next, just wanted to give you a small update on the next IASP events. IASP is offering 2 events on COVID-19 and pain, both in September, and registration is free and open to everyone. There'll be several sessions on the latest advances in COVID-19 and pain, and we're very much looking forward to providing this education for you to our community. The 2022 World Congress, it will be next year in Toronto, Canada. Registration will open in October. You can visit our Congress website for more details about our offerings there. And we invite you to also join IASP or renew your membership today if you are interested in all of our resources and programming. Today, we welcome Dr. Christopher Chang, who is our moderator for our panel. He will be introducing our speakers, Dr. Altug and Dr. Hui, who will be presenting today's webinar. Christopher, over to you.
Okay, thank you, Jeanette. So, yeah, my name is Christopher Chang. I'm a naturopathic doctor. I'm here to introduce Dr. Kakehui and Zia Altu. And basically today we're going to be talking about low back pain in terms of treating it with integrative medicine. So with that said, I wanted to also mention that it's an honor to be able to moderate for this webinar, because I've known Dr. Hui for several years now, and Zia has also been a kind of a mentor to me as well, in the sense that I've been reading several of his literary works. And all I can say is that basically you guys are going to learn a lot from these two, okay? So without further ado, I don't want to take up too much of their time. Let's begin with Dr. Huey's lecture, okay? So let's get that started.
Hi, thank you very much for the kind introduction and invitation by IASP to allow me the opportunity to share with so many of you from around the world our experience in caring for patients with chronic pain, particularly chronic back pain and low back pain at UCLA. I'm so glad that IASP has the theme on back pain this year, because this is really a very important, common clinical problem that we encounter in our clinic and probably in many of your clinics. So let's take a look at the statistics about low back pain. So the single leading cause of disability worldwide, one of the top 3 conditions patients see their doctors. And disability caused by back pain has increased by 50% between 1990 and 2015. More than, just in the US, $50 billion spent on low back pain each year. Now, most cases of low back pain are non-specific, meaning that there is no structural or severe conditions causing it. But I want to mention that the non-specific low back pain actually has clinical implications from me as an internist, because from an East-West perspective that I'm going to talk about, it has enormous implications relating to many other problems besides the pain, because most people who present to us with pain, but when we see them, there are many, many other issues that by virtue of using the model that I'm going to share with you will allow other conditions to be helped as well. So let me just start with a case that I shared at a WHO meeting, year 2000 in Japan. This is a 72-year-old Caucasian female with left hip and left lower extremity pain. And she failed decompressive lumbar laminectomy for spinal stenosis. Now, she actually have many of the usual approaches, like 6 epidural steroid injections, physical therapy, medications, lumbar laminectomy, and also spinal catheter implants for morphine infusion. Now, this is 1996 dollars, 34,000 US dollars. Now, the patient was then referred to us, and using the model that I'm going to share with you, with our approach to trying to understand the person, the stress that they are going through. We teach the patient how to do acupressure. We do acupressure massage, myofascial release, and then we do acupuncture and trigger point injections, and teaching the patient to do the appropriate exercise. The patient experiences complete relief. And this is actually the case was shown on Discover Health channel in 1999. Next slide. So at that time, after working with many patients using this model of an East-West model by blending traditional East Asian medicine, Chinese medicine, with the very best of biomedicine as practiced at UCLA, we have been able to help many patients. Let's go to take a look at what I want to emphasize, because it's like my dream come true. I started my journey at the UCLA School of Medicine in 1971, so it's been 50 years for me to have the time to figure out how to blend the very best of Western medicine using internal medicine, clinical pharmacology, geriatrics, at the same time try to understand what China has been embarking on integrating the two medicine. And we now have built a center with several clinics that allow many of the patients that were referred to us to get some relief from their pain. Next slide. So for some of you, particularly those who know Professor Han Qi-Sang on the right-hand corner, he basically was the sort of guru in sharing for us the neurochemical basis of acupuncture analgesia. And in 1982, he wrote a very, very good summary of that research, in the Annual Review of Pharmacology. But these are all the many other integrative pioneers in China that we have interviewed. And I've learned from many of them. So our work is not just pain, but really how to blend the two medicines to create something that would help solve many problems that are facing us clinically. Next slide. So in 1993 December, I established the Center for East-West Medicine, and our focus is not on a particular condition or particular modality, but to try to build a model that would blend the best of Western and Chinese healing traditions to provide healthcare that is safe, effective, affordable, and accessible for people, families, and communities. So now we are ready to scale with our educational projects. Next slide. Without the support of my chairman of medicine for the last 27, 8 years, we would not be able to build a model, but at the same time to scale it within the UCLA health system. And what I want to emphasize is that unless you look at the whole person and its interaction with the natural and social environment and try to educate the patient what they can do for themselves, we will not be able to solve the many health care crises that are facing us with chronic pain, opiate crisis, funding, unsustainability with the aging of society, and also many of the patients who are suffering from long COVID. Next slide. So just a definition of what is integrative medicine. I will talk about the particular version that we are using at UCLA. Person center is really the focus, a systemic approach, not a reductionistic approach, utilizing all appropriate therapeutic modalities, leveraging the body's ability to heal itself rather than suppressing the symptoms. We try to help the body regain their homeostatic reserve so that they can rebalance the pain, no pain balance, and all the other abnormal physiology, bring it back to normal. So that's why this model is not just to take care of the pain, but take care of the person with pain. Okay, next slide. So in our clinic, as I said, we just focus more on traditional Chinese medicine. We emphasize the biopsychosocial ecological perspective. And then we focus on the soft tissue because before you get to the bone and the nerve and the blood vessels, a lot of patients already have a lot of myofascial problems. And unless you put your hand on the patient, you would not be able to make that diagnosis. Next slide. So we actually have grown from me as a single practitioner to now have many of the East-West trained internists and family medicine physicians that are all actually gone through our fellowship. And we also have acupuncturists who are also trained in the East-West model. And at UCLA, we have about 40,000 patient visits a year. Before the COVID slowed us down a little bit, but right now we are very busy with many, many patients still waiting to get in and referred by many of the subspecialists at UCLA, including the pain service, the spine service, the neurology, and so on and so forth. Not just for pain, but also for many conditions that the patient are intolerant of medication or surgery. So we have an inpatient program as well. And so we have different clinics within different parts of LA. So what is our framework for approaching the patient? We obviously have been very lucky with the backbone of very, very good Western medicine within UCLA. But we really try to have a very flexible, comprehensive approach to look at the person, make sure that I understand the importance of balance, flow, and spirit. And we go to the root causes. The root causes are oftentimes at the personal level, in terms of their way of handling stress, their exercise, their sleep. Some of these issues will be covered by my colleague later on. So we basically, look at the whole patient, addressing both the local and the global issues. Okay. So anyone who would like to know more about this model, we wrote this paper for the European Journal of Person-Centered Medicine when they launched the journal. And even the name Person-Centered Medicine is a little bit different between how we perceive it in the West and how it's perceived in the East. At least with the traditional medicine where, they look at the whole system and its interaction with the natural and social environment. But obviously in China, there is the concern that they may be Western medicalized Chinese medicine. Next slide. So this is a very, very good paper written by the chairman of medicine at Harvard Medical School, focusing on putting the patient back together, the importance of social determinant and the limits of reductionism, and obviously the emergent field of network medicine. So even though I'm trained as a geriatrician, we take care of people who are elderly, but now we have a lot of young people coming in. And what we are trying to develop is that a lot of the seeds of ill health were planted during childhood. And so we're building an integrative adolescent problem as well. A lot of young people are now having their neck pain and back pain because they have trauma of different type. It could be mechanical trauma, falling from a horse, from a bicycle, but a lot of psychosocial trauma as well. And so we'll get into some of these later on in the presentation. So I want to emphasize that we need to use the hand to examine the patient where the pain is. I just help a patient who had 3 years of pain and studied by numerous people, but we were able to identify this as a myofascial problem. And using a few visits, we were able to solve a 3-year chronic pain problem. So MRI would not show myofascial problems. Next slide. So we have the whole person assessment, and then after that, we educate the patient regarding the way of handling their stress. We teach them how to do acupressure. We talk about the right nutrition for their constitution. In the clinic, we would do acupuncture or acupuncture-like stimulation, like trigger point injections. We adjust their medications. And most importantly, we teach the patient what they should do for themselves. And this will be covered very nicely by Dr. Atu later on. Next slide. So stress of different type may over time, the load would accumulate, and then mediators of neuroendocrine immune stress can have adverse effects on various organ systems. So that's why it's not just the pain that we are treating. We treat many of the things that lead to the spasm of muscles and fascia that lead to the pain. And now it will progress to the specific with problem with spinal stenosis and also with disc herniation. But realistically, many of the non-specific type of spasm will lead to many other health issues that we will be able to reverse by virtue of having the patient prevent the spasm. Okay, next slide. So that's why our patients, we encourage them to either use yoga or Tai Chi or the 8-Brocade Qigong, music therapy and meditation and mindfulness-based stress reduction type of approaches. These are all part of what we do and refer to patients. So let me just say a few words about acupuncture. The beauty of acupuncture is that it will help restore the balance between particularly the parasympathetic and sympathetic, because most people under stress, they have sympathetic overdrive. We want to rebalance it so that the vagal tone can modulate the inflammatory cascade, because that's really responsible for many of the chronic conditions. Next slide. So obviously, we now have increasing data in the Western world about the use of acupuncture for chronic pain. And ever since many of these studies were published, we get more and more referral. And if you want to kind of look at, how acupuncture is used to treat chronic low back pain. This is a good paper in New England Journal of Medicine, but we really use acupuncture not just for the chronic low back pain, but all the issues related, that contribute to the low back problem. Next slide. So this is particularly important because a lot of patients come to us who do not want to be on opiates, and some of them we have to help them get, taper off, their narcotics. Because patients come to us with not just one condition, they come to us with many conditions, but by virtue of using acupuncture-like approach, you don't even need to use needles because you can use TANS unit. We actually have taught patients how to use tennis ball, golf ball, different ways of re-regulating, their system by stimulating the appropriate acupuncture points. Next slide. So patients come to us with at least 5-10 problems because as a clinic of last resort, they all come in with many conditions, but by virtue of using acupuncture-like stimulation and as part of the comprehensive approach that we use, we are able to help patients with many of these conditions. So it's not just acupuncture alone, it's part of a comprehensive system. Next slide. So trigger point now for Western medicine physicians, when I was in my early training in the 1970s, I really was fascinated by Janet Travell's work on myofascial trigger point. So what I've done was to integrate acupuncture point with trigger point and also tender point of fibromyalgia. And using that model, I've been able to help many patients who come to us with a chronic pain, but by virtue of restoring the patient's homeostatic reserve, we are able to help their other concomitant problems as well. Next slide. So for those who would like to look at the sort of evidence base for many of the non-pharmacological approaches, the white paper put together by the Consortium of Integrative Medicine would be a good sort of a reference. It was published 2018, maybe a little bit dated, but a lot of the good information. Heather Tick was the main author. She was running the University of Washington, Seattle pain clinic, where Bonica, started out the pain clinic model. Next slide. So we basically are, the consultants at UCLA, but I want to bring this actually to the public, to the person at home. We want to train many of the health coaches to help people to understand what they can do for themselves. But at least at UCLA, we have the ability to refer to any of the experts that can complement what we do. And so these are the coaching that we do, and I think some of the topics will be covered by my colleague in the next 20 minutes. Next slide. So with that, I thank you for your attention, and then we will have Atu who will cover the evidence-based approach of self-care, very practical material that he would share with you.
Okay, thank you, Dr. Huey. So, it was a little rushed because we don't have that much time. Having known Dr. Huey for several years now, I will say that he does have a lot more wisdom to share, but unfortunately, we do have some time constraints. So if you guys have any questions, be sure to put it in the Q&A section, okay? So without further ado, we have Zia Altu, who has a doctorate in physical therapy. We'll be talking about certain exercises and also targeting sleep, as well as also looking at your posture. So without further ado, go right ahead, Z. Oh, you're muted there, Z.
Thank you very much. I really appreciate being a part of this presentation. And this is a little bit about my background, but I just wanted to say that I used to work at the UCLA Medical Center for 13 years, and I'm very grateful to know Dr. Huey. And in the recent years, I've been working more with him, and I'm extremely grateful for all the knowledge that I've gained. And I also thank Dr. Huey, as well as Jeanette and the IASP, and for Chris for helping us put this all together. I don't have any disclosures to disclose or report. This is just briefly what I'm going to cover today. Posture and back pain, pretty much relating to the office worker. Many different kinds of jobs out there, but I chose to focus the posture on the office worker. We'll talk a little bit about sleep and stress and some integrative exercises. This is a recent article that I'm extremely grateful to have published in July of this year. So if you wish, you can go to these sites and you'll get an abstract for it. If anybody wants the specific article, I can send it individually. I just can't post it online yet as a full text. Okay. So I want to focus on posture and pain, how posture impacts pain. So here's a study that looks at individuals who sit for a prolonged period of time, and it's not just back pain, but it's also, it can impact cognitive function. So if you want to learn a little bit more about how that is, you would have to go to the study, but it's interesting. It's not just creating stiffness and pain, but prolonged sitting can have other associated factors with it, such as cardiovascular factors. And here's another study that shows that prolonged standing, there are jobs that people are standing for a prolonged period of time, such as nurses, such as people who work in banks, postal workers that have to deliver the mail, so they're standing and walking. So that can also create problems for some people. So here are some practical things that we need to ask for office workers. If people are going to be taking breaks, should the break be a physical break or a mental break? If the physical break is important, then we need to design programs specifically for stretching and movement and exercise. Other times, a person may need a mental break just to step away from that particular task and maybe initiate another task to give the brain a chance to recharge. Now, what should the person do during this break? Should they stand? Should they do stretches in sitting, move, bend? What should they do? So we'll kind of go over that a little bit. How long should these micro breaks last for somebody who's an office worker? I've seen research that ranges from 20 seconds to 2 minutes. So a person is working on their computer, researcher, medical professional, attorney, engineer, all the different jobs that are in sitting positions. They may have to get up and do something for about 20 seconds, or perhaps up to 2 minutes, depending on the tasks. The next question is, how often should the micro break occur? And I've seen literature that shows that it should occur every 20 minutes to 120 minutes. Now that's a pretty big range, and that probably depends on the tasks that are involved. So not all of them were office workers, but we would need to figure out what is the ideal pain or the ideal time frame for our patients so that they don't get those myofascial pain and those restrictions to begin with. So trying to prevent the problem before it becomes a big problem that needs to be treated. So here is an interesting comment from Dr. Stuart McGill. He wrote the book, Low Back Disorders, and he says tissue loads must be migrated from tissue to tissue to minimize the risk of any tissues accumulating microtrauma. So he even encourages, if a person is going to sit in front of a computer for, let's just say 20 minutes before they get up and move around, even those 20 minutes should not be perfectly straight and just without moving. He recommends that the person should vary their position a little to the right, a little to the left, and varying the tissue loads, and then getting up and moving around. So that's an interesting statement. And the person can also do small things even while they're sitting. They can tap their feet, they can move their legs back and forth, they can do toe up and heel up movements to get some circulation back to the brain. If you've sat there for a long time, you know that the brain becomes a little sluggish. The circulation slows down. Now, what can a person do in standing? One of my favorite stretches that I show my patients who are office workers or who are sitting in front of a computer is to try to get up at least every 30 minutes for 30 seconds. It's easy to remember, the 30-30 guide. And then what they would do during that movement, that time that they stand up, is pretty much what the picture is showing. They would stand up and press their palms into the ceiling. That will stretch out the latissimus dorsi muscle. It will also create thoracic extension, pretty much exactly the opposite of the seated position. There are many other things that a person can do once they stand. They can march in place. They can do shadow boxing type of movements, open their hands. But the key is, if a person is sitting for a prolonged period, they need to get up. The same thing is true for somebody who is standing for a prolonged period. They may need to sit and take a break. So here are some creative ways that people working in companies can come up with ways of getting movement for individuals. You can have a fitness court that's outside, which incorporates bright light, fresh air, a little bit of sensible sunshine exposure. And there could be a fitness trail around the office space. You could have a table tennis. You could have a little area where people just go in and play table tennis for a period of time. I know a lot of the companies like Facebook, Google have these kind of rest areas because they know that getting people up and moving and socializing increases productivity and increases the mental capacity to be creative. So these are some interesting things. You could create a Tai Chi or a Qigong club right in your dress clothes. You don't really need fancy clothes to do a 10-minute or 15-minute Tai Chi or Qigong movement. You can do it all in standing. You could have some meetings in walking. I know some of the CEOs have done this in the past. Steve Jobs, who is the CEO of, formerly the CEO of Apple, used to take walking meetings. And it's outside, it's fresh air, less stress. And you can also have people do yoga breaks. Yoga might be a little bit more involved. You might need a mat and a little bit more space, but again, it's something that could be doable for different places, different companies. So sleep is important because there is an association with sleep and back pain. There's also indications that lack of sleep can change mood and a person's function. So that's something we need to also take into consideration. These are just selected articles on sleep. There's hundreds, if not thousands, on the effects of sleep or a lack of sleep on productivity, on pain, on mood and anxiety and depression. So this is just showing that it can impact pain and back pain. So what would we tell the person practically for sleep management or sleep hygiene, as a lot of researchers call it on PubMed? Consistent sleep. Try to get consistent sleep at least 7 or more hours per night for most people, for most adults. Establish regular waking hours. Make sure that the room is dark and cool and quiet. The bed is comfortable. The pillow is comfortable. If any of these factors are off, it can impact the person's ability to get restful and restorative sleep. And we also know that stress, my next component, can impact a variety of conditions, heart conditions, cardiovascular, and musculoskeletal conditions. And we see that stress can impact back pain because it has a tightening effect as one of the factors. So if we know that stress is a factor, we need to provide individuals good stress management strategies. And that's going to change from person to person. For one person, it might be doing yoga. Another person, it might be doing Tai Chi or Qigong. Another person, it might be going out and walking. Another person, it might be meditation. Other people, it might be washing their hands with lavender soap and kind of smelling the lavender scent. So we need to find strategies that are specific for that particular individual. And finally, I wanted to get into a little bit of integrative exercises. Dr. Huey's been mentioning the various components that they use at the UCLA East West Medicine Clinic, and they do incorporate Qigong and Tai Chi. Well, here are some studies that show that yoga can impact nonspecific chronic low back pain. Tai Chi, there's a systematic review with 10 studies in the systematic review that Tai Chi alone, or in addition to physical therapy, can be beneficial. And Baduan Jin, which is a form of Qigong, this is something I do every morning. It's a very easy to learn routine, is also very, very effective. And these movements are very old and very ancient, but they're brilliant. So let's look at why these movements in the Qigong called Baduan Jin is so important. You already have in number one, thoracic extension, stretching the latissimus dorsi, and pretty much the exact opposite of sitting position. You have the archer position, which is getting thoracic rotation and you're getting scapular retraction. Here, you're getting a stretch in the thoracic extension, some trunk rotation, a little bit of flexion, and the energy punch, as some people call it, and then just the finishing pose. So this is just an easy to learn sequence. What I do with my patients, I might teach them components of this. I might show them just number one as a home exercise program. And if they're interested, I might show them the entire sequence. The advantage of Qigong, it's 8 exercises. With Tai Chi, the short form has anywhere from 30 to 50, depending on which short form of Tai Chi you're using. Some people have a little bit of a problem memorizing 30 to 50 poses. The long form is somewhere near 100, depending on plus or minus which form you're using. So Qigong is a very easy way of introducing individuals to one exercise at a time or a sequence of 8. And if they really like it, they can progress into Tai Chi. So my conclusion is really to try to find the key areas of a person's lifestyle that's impacting their pain. Is it the stress management part? Is it the sleep part? Or is it the lack of exercise? Or is it nutrition? We didn't touch on nutrition, but nutrition can also have an impact on pain. And I like to use the trial and success approach. Try different things and see which one is working for the person. Try to create a sustainable exercise program. And the key word is enjoyable. A person will do exercises if they enjoy them. And finally, the relaxation routine should be specific to that person. Not everybody wants to do meditation, but maybe some people would like to go out and walk in a park. And that's a meditative movement for that particular person. So thank you very much. I appreciate everybody joining us from a global audience. And thank you. And here are my references and slides. And Chris, I'll let you.
Sure. Thank you, Z. That was very informative. Thank you. Like Z also said, I do also want to thank everyone for coming into this webinar. I know that there are people from all over the world, and it's either morning over there, afternoon, nighttime, maybe at past midnight. So we really appreciate you all taking your time to come over here and just soak in the wisdom that these two have to offer. So with that said, I guess now is the time to open up for the Q&A section. So I'm already looking at the box, and you guys have a lot of good questions already. So I'm just gonna start, asking Dr. Huey and Z about some of your questions. So let's see. Okay, so one of the questions is, what book, I'm assuming this is directed to Dr. Huey, what book will you suggest for learning acupuncture?
Well, it kind of depends on your background. If you are going to want to be practicing acupuncture, then some people go through a whole 4-year program. As physicians, you may be able to cut it down to 2-3 years. And obviously, if you just want to have an introductory text, then there are different type of acupuncture books. I mean, it all depends on whether you want to know something about acupressure. That we recommend to patients, acupressure's potent points. If this is a major textbook, there are other major textbooks for acupuncture and manual for acupuncture by Peter, Deadman, and but again, our doctors, some of our doctors actually go through after internal medicine and a 2-year fellowship with us, and then they get a degree in Chinese medicine, become a licensed acupuncturist. Some would just take a 200-300 hour course so that you can incorporate as a physician acupuncture as part of your practice. So it's difficult for me to tell you. If you can tell me your background and what you plan to do with learning acupuncture, I can give you more specific answers.
Okay, thank you, Dr. Huey. So along those lines, some people are asking, what are the likely mechanisms for acupuncture? And I guess how does a course of acupuncture look like? So I believe you do have some slides on that. Let me go to it. So do you mind explaining to the audience some mechanisms?
Obviously, with the gate control theory, that's the initial, explanation for, acupuncture when it was first introduced in the early 70s. And then the research in the mid 70s, and at that time when endorphins was just being discovered, naloxone was used to reverse acupuncture-like effects. But then many neuroscientists would then look at the various neurotransmitters from catecholamines to serotonin to glutamate and also nitric oxide. One thing that I think I always quote, and educate our medical students and residents and fellows is that the functional MRI done at Harvard demonstrate that when you do acupuncture, and in particular acupuncture point used for stress, it basically modulates the amygdala. So actually, what I really emphasize is that you can use acupuncture to tone down the sympathetic outflow. I mean, that's a lot of very important neuroscientific type of research done by the late Dr. John Longhurst at UC Irvine, particularly stimulating the pericardium 6 point. But there's also enhancing the vagal tone, as I mentioned earlier, because it really is important, to enhance the vagal tone to decrease inflammation. Because I think that many of the so-called CAM approaches not the drugs that we use. The deep breathing and many of the stretching and of the neck and the back. It's very important to basically decrease the sympathetic tone and increase the vagal tone. I think that balance of the parasympathetic and the sympathetic is really, I think, a major mechanism for the many effects of acupuncture.
Okay, thank you for that, Dr. Huey. So you mentioned acupuncture and acupressure several times and certain acupuncture points. Are there certain acupuncture points you would like to recommend for today's audience right now, either for chronic back pain or just pain in general?
Well, obviously, one can obviously stimulate. If you're not pregnant, if you are pregnant, please do not massage this point because it's actually used during labor to enhance the speed of the contraction and the strength of the contraction, but then you don't want it when someone is pregnant. But I teach many of my patients how to massage, not the point, but almost like massaging the muscle against the second metacarpal. Usually when you are stressed, that muscle is a little lumpy and can be very sensitive. But if you are healthy and the stress is minimal, that muscle is very smooth. So it's really useful, particularly for anything in the head. But this is a major point that we teach all our patients and all our students. So this is the functional MRI study that I talk about, that on this particular point modulates the limbic system on functional MRI, was published in 2000. Another very common point that I teach all our patients and many of you now, if you crisscross your fingers and then you rest on your occiput, you can feel the knots in your neck. Now you can massage the occiput with the muscle against it, or you can just slide down your thumb and find those knots in your neck. And I have given many lectures about the importance of getting rid of the neck spasm. It's like a Charlie horse of neck muscles, and it can lead to so many health problems that we are able to solve. Eye problems, sinus problems, ENT problems. We also help patients with GI problems and even cardiac problems as well, because the tight neck is not just causing pain. So for low back, we basically teach patients how to use a tennis ball, put two tennis balls together in a pair of stockings and roll up and down against the wall or in bed. Or we teach them how to massage, obviously, a point behind the knee and also the calf muscle as well. Now, this is another point that we commonly use for nausea and vomiting, but also for sympathetic overdrive. So these are some of the top 10, 12 points that we teach all our patients over time. Okay. So obviously quite a number of research for nausea and vomiting if people take medicines. This is another very common point that we use with back pain, because many people who are angry or they are under a lot of stress. This point is very sensitive. It's two fingers back from the web between the big toe and the second toe. And again, the functional MRI, have demonstrated when you stimulate this point. So we usually use the LI4 and liver 3 together. This is another point that we also teach our, patients, particularly, patients with a lot of GI problems and immune system problems. But I usually teach patients how to use the TENS unit, stimulating both GP34. One of the points that actually from a TCM perspective, would help with all tendon related problems. So I think that there are many different ways for you to help the patient, and this is simple enough that that they can carry with them, not the drugs, but you can help using your hand to stimulate the body to release the chemical that you would like it to relieve inside you. So in our website, there's some technical problem with this website right now, but otherwise we have been teaching patients how to use acupressure for back pain and neck pain.
Okay, thank you, Dr. Hearing. That was very educational. And yes, there are some technical difficulties, but you guys can always visit the official website for the Center for East-West Medicine.
Well, we are in the midst of running a 30-hour course for people from all over the world, but particularly for our students who are pre-health, whether they go to medical school or they, like Christopher, who go to naturopathic school. Some of our students go to acupuncture school, and some become, different types of health professional. What we want them to know is the big idea about why we need a new health model, and that it's into our second week already. And one of the lectures yesterday was stress and inflammation. And we teach our students about acupuncture and also some of the key acupuncture points I shared with you earlier.
And some people were asking about email addresses. So this is the email address you would, I guess, address if you were to try to contact Dr. Huey, cewm@mednet.ucla.edu. There is a question for Zia asking, let me see over here. Give me one sec. Let me see. Okay. Where can we find different exercises for low back pain using Qigong?
That's a good question. There are several books out there. I would have to look at those. I might have them listed in my references. If they're not there, please feel free to email me directly. And my email is, should I say it now, or do you want to just put it on?
We could type it in the chat. Oh, can you type it in the chat yourself, maybe?
Okay, I can do that.
Yeah.
And there are really good YouTube videos that go over, if you go into YouTube and enter Qigong and Baduan Jin, it will show you those sequences. Also, Dr. Paul Lam, L-A-M, he's an Australian physician. He has an excellent tape called for Tai Chi. And also he has another one on the 5 elements of Qigong. It won't be the same Qigong I mentioned, because as I mentioned, there are different forms, but he does a phenomenal job, Dr. Paul Lam. And I believe his website is taichiproductions.com. So that could be another resource for you. But there are other individuals who are Qigong and Tai Chi practitioners who put different styles. You'll see many different interpretations. Even if it's Qigong and Baduan Jin, you'll see many different interpretations of it. So you as a clinician can modify these poses. I as a physical therapist have taken poses and modified them for my patients so that they're doable.
Well, actually, let me just explain Qigong. Like in Chinese medicine, we talk about Qi, the vital energy, that you want to have enough of it or you don't want it to stagnate and not. So in a sense, Qi, people with Qi stagnation, meaning that I think there's a neurotransmission problem that would lead to spasm of the muscles, whether it's striatus soothe muscle or, sort of people who have the tension in their back or in their neck or in their gut. So I think Qigong is like work to to basically get more qi, but also to make qi flow. So in a sense, Tai Chi is a very important brand of Qigong. Ba Dun Jin is also a form of Qigong, which is simple. And I concur with Zia that this would be a simple type of body-mind exercises that they call it kind of moving meditation. Is simple enough that we recommend to many of our patients.
I placed my email in the chat room in case anybody wants to contact me directly regarding more literature and more information. I'm happy to pass on more research studies as well as some recommended books.
Okay, thank you, Z, and thank you, Dr. Huey. So we are running out of time. Unfortunately, we can't get through all the questions here, but I'm glad that everyone is very curious about what Dr. Huey and Z do at their practices. I do want to conclude by saying that, hopefully all of you kind of gained the knowledge and more importantly, the inspiration to, treat people holistically, to treat them with an integrative mindset. It's not necessarily about the particular therapy that's important. It's about how you approach a patient. And hopefully that's what you kind of got from this entire webinar. I will say that it's thanks to Dr. Huey and thanks to Zia that I ended up going into the natural medicine field. I joined Dr. Huey's summer course however many years ago. It was probably like 8 years ago now. And that's kind of what kind of gave me the eye-opening experience that, this is what patient care should be about. It's not about just looking at the low back. It's about treating the whole person, looking at the stress levels, looking at the sleep, having them, just become, healthier by just addressing the most basic needs, right? It's not, you don't have to resort to all the high intervention, modalities just to treat, an ongoing issue like chronic low back pain. So, hopefully you guys all kind of appreciate the fact that, sometimes it's not about having to look at the particular problem, but just look at the person, right? And, at the end of the day, even if you do a very simple procedure, they may end up feeling better as a result. So, with that said, I guess I would like to just say that thank you for everyone for joining this webinar, and I'll send it to Jeanette.
Thank you.
Yes, thank you, everyone. And we're really happy to have you joining us today. And as I mentioned in the beginning, there'll be a recording available on IASP's website if you wanted to rewatch the webinar or if you wanted to share it with any of your friends and colleagues. We hope you'll join us for our next Global Year webinar in September and visit our website for any further resources or any other questions you have. And thank you very much. And we look forward to seeing you next time.
Thank you, Jeanette.
Take care and take care of yourself and take care of your patients with some of the approaches that we share with you. Thank you.
Thank you.